Hello and welcome to this session of pathology. This is Sri Kumar, Professor of Pathology from Masa University, Malaysia. And today's session is on pathogenesis and types of embolism. So in today's session, I'm actually going through an overview of what is an embolism, and I'm going to specifically go on to a few types of embolism, more specifically trying to focus on pulmonary thromboembolism, because you need to know clinically various aspects of pulmonary thromboembolism. This is where you will see a clinical pathological correlation and a little bit on other forms of embolism. In the previous session, we actually saw that there are three factors that predispose to a thrombus formation. It is the same three factors that predispose to an embolus formation. Now, we've gone through the Werkow's triad, and it is the same Werkow's triad that we're actually go through now. The first part of the triad is endothelial dysfunction. The second part of the triad is changes in the flow pattern of the blood. The blood actually increases in flow or decreases in flow. When it increases in flow, this is called turbulence. When it goes slower, it is called stasis. And then changes in blood coagulability, which means when there is a damage to a blood vessel, RBCs, platelets, and fibrin comes and attach to the damage in the endothelium. And either increased flow or a decreased flow, that is either turbulence or a stasis, either of these is actually going to be a predisposing factor in a thrombus, which is the same for an embolus, because in the next few slides, we are actually going to see that it is a thrombus that breaks down, dislodges, and forms an embolus. So based on what we saw in the previous session, we know that thrombi would actually break up, or a thrombi undergoes changes. So what are the outcomes of a thrombus that grows up and blocks a blood vessel? When a thrombus blocks a blood vessel, this blockage is occlusion. And when a blood vessel is occluded, the following are the outcomes. The first is lysis. Lysis is where the clot breaks down. Now, usually after cardiovascular event such as maybe a myocardial infarction or any condition like a blockage in the coronary artery, the patient is taken to the hospital and we give an injection of streptokinase. That is to undergo lysis of the clot. Our body naturally has a fibrinolytic system itself, which will help in lysis. If the clot doesn't lyse, it propagates. That is, the thrombus undergoes an enlargement and it increases in the dimension and the length along the blood vessel. The third outcome is organization, where once a thrombus is formed, a granulation tissue forms and grows into the thrombus. Now, you all know what a granulation tissue is. You know that granulation tissue is a tissue of healing, and this consists of fibroblasts and blood vessels, and this grows inside the thrombus. And once an organization occurs, it undergoes recanalization. The granulation tissue that is formed, some of the small vessels in the granulation tissue will enlarge and open up, and that will cause the blood flow to slowly start recanalizing. But this will not give the full blood flow. It will not revert the full blood flow, but at least a small amount of blood will start flowing. But again, that is not enough for survival in the case of a myocardial infarction or in the case of any ischemia. And finally, a thromboembolism, where the thrombus fragment breaks and it goes to different parts of the body. That is called an embolus, which is what we are going to see today. Now, this is a blood vessel where you see nothing but granulation tissue. This was formerly a thrombus, but what you see as V are the slit-like vascular spaces. And the surrounding area is just connective tissue. This is the blood vessel that is obstructed. This is a blood vessel that is cut open to reveal a thrombus that has obstructed the full lumen, but in three small areas, the lumen has opened down. This is recanalization. Now, as much as the canal is open again, you can see that it is not adequate enough for the blood to flow through an otherwise full wide lumen. So in many cases, recanalization is not that very effective. Now, this is a pulmonary artery that is open, and you can see a clot that is sitting here, a thrombus. Now, as much as this is a thrombus, it doesn't arise in the pulmonary artery. it has risen from another part of the body, which is usually the lower limbs. So this is broken down from there and it reaches here. So this arises in the deep vessels of the lower limbs, and so this is an embolus. So this is a thromboembolism that is lodged in the pulmonary